Eric Walter. I'm a podiatrist by profession. I do foot and ankle surgery here. I'm also the director of the residency program. We have 15 podiatry residents here who learn foot and ankle surgery and how to take care of people's foot and ankle issues. We have a busy clinic that the residents run through. We also have our own practice here in the hospital, and I operate every week. We're a very diverse group. I think Montefiore breeds diversity, so I think students feel very comfortable coming here to learn and to train. So I think one of the great features of this program is we have a very diverse population of residents and people. So not only the patients are diverse, but also our actually teachers and learners are diverse. So that's a positive thing. In my undergraduate school up in Boston, I was pre-med and I was also on the track and cross country team. And I'd seen my teammates getting injured. And they would have these weird things done to their shoes, these pieces of plastic or rubber placed on their shoes to kind of prevent overpronation or to control the way they run. And they'd have to go to physical therapy, and they'd miss entire seasons sometimes. And that, thank God, never happened to me, but I was kind of fascinated by that. And then they had a program on podiatric medicine and surgery at our school. And I went to it and really was focusing more on the sports medicine side of things, and that part of podiatry. So I started following a local podiatrist up in the Boston area who happened to treat some of the biggest runners at the time, like Bill Rogers and Joan Benoit. You have to be kind of old to know those names, but they were the best marathon runners in the United States back in the early 80s, and they were his patients, and I learned about what an orthotic was and how that helped runners. And I learned about some of the other things that, podiatrists do. And I said, I think I'd be interested in that. So that's the path I took. I went to school for that. And then when I finished, I thought I was going to be doing just athletes and sports. But then I did a residency program for 3 years. And I ended up getting really interested in foot and ankle surgery. So my practice became more focused on surgery. And I enjoyed the ability to teach young doctors surgical skills and how to treat patients. And so that drew me here. And then most importantly, something that I touched on earlier in this conversation, the diversity. It's just amazing the different types of people we treat. And we really do strive here to treat everyone well and treat everybody with respect and dignity. And I think that's the name of the game. That's how you should always treat human beings. And I just think it just makes people happier, healthier, and just we provide a good service to the community.